So I'm here with Dr. Massry, one of my mentors, the guy who taught me everything I learned about eyelid surgery and more, life in general. And I'm really excited because it's an opportunity to do a case together. So when you get to operate with someone who's the best, arguably one of the best in the world, but also someone that's taught you everything, it's really rewarding. So Dr. Massry performed a certain part of the case. He started with the top. Tell us what you did on this patient.
First of all, this whole thing about the best. I just work hard and want to do a great job for patients. Thank you for that. And I've had the opportunity to work with Dan before, so this is a pleasure. So we did a combined case today. This is a woman whose surgery was not complicated, but made more difficult by the fact that she's had a lot of filler in her cheeks and lower lids. We did a brow adjustment on her. I don't call it a brow lift, a reset, or a recontour. Her upper lids, fat grafted her upper lids, did her lower lids with fat grafting. She probably has a little redundant skin, but Dr. Gould was going to do a laser her face, so he's going to laser her skin to kind of top that off so that we can avoid an incision under eyes. She looks very natural now. She's going to do great.
And then I'm going to come in and do the lower face and neck, dealing with the deep neck structures, deep plane face and neck lift, and a little fat transfer, and like you said, CO2 laser. The nice thing here is you get a combination of surgeons, so 2 instead of 1. A lot of expertise coming from Dr. Massry with regards to eyelid surgery. I'm stepping in to do the lower face and neck, so you kind of get the best of both worlds. But also, if you're with surgeons that have operated together or know each other quite well, it makes the experience and outcome, I think, better because you have the ability of 2 surgeons putting their heads together on all parts of the case.
I've been doing this 30 years and I'm constantly learning. And when you operate with someone else, you'll see something, the way they hold their fingers, the way they hold an instrument. It's amazing how a minor thing makes a big difference to outcomes at surgery at this point. You've done something 5,000 times, you have not perfected it. Perfection comes with continued growth, and this allows that kind of a higher level of education. All that matters is the patient doing what I taught from them, and there are no egos here. All the doctors I work with, Dr. Dan, that Dr. Gould works with, there are no egos to bruise here. We're all one big team.
Okay, Dr. Massry's just finished his portion of the case, and you heard me describing a little bit about what we're doing and why we're doing it. I'm gonna help a little bit with the lower eyelid. I'm doing a CO2 laser in this area to improve the skin quality and texture. And that's really important when someone's deflated and has lost volume. Then I'm gonna do lower face and neck lift with a fat transfer. That's gonna improve the quality of volume in the cheeks, the chin, the lower mouth, and the lips. This patient is not consented for media, so we're not gonna be showing you any of the before and after results. And that's okay, patients don't have to give consent, but that's why we're not showing you any of the surgical things that have been done. We wanted to focus on the collaboration so you could understand more about kind of what goes on behind the scenes and how sometimes we work with other providers, other surgeons to really maximize the quality of the result. Other surgeons I work with include rhinoplasty surgeons, other body surgeons. There's a combination of different providers I work with in many different settings to give the best results for my patients.